very good day to all our viewers. So, in the series of having conversations with multiple personalities and multiple experts in our society, so today we have with us Dr. Chandragupta, who is a dentist by profession, and there's so much of social service that he does in the scope of dentistry. So, Sir has been a dentist for the past 24 years and counting, and he's done a lot of social services. He has conducted more than about 850 camps and has given dental help to almost a lakh and more patients. So, there's a lot of dental awareness that he's been creating across Tamil Nadu and across India. So, without further delay, thank you so much, Doctor, for being with us today in your very, very busy schedule. And very rarely we get to see doctors like you who really do so much of social work from bottom of your heart. So what inspired you to getting into social services as a part of your dentistry?
First of all, I should thank Mr. Srinivasan, who's my good friend and my friend philosopher for the last more than 15 years. He was the one who introduced me to Dr. Abdul Kalam. Dr. Kalam had visited Chennai to Rajbhavan, and a set of people had visited him. From my childhood, I was always longing to help somebody. Whenever I get a chance, I never miss a chance to help. So, and fortunately, I took up dentistry. But till the day I joined dentistry, I never knew that I was going to join. I was actually pushed into this profession, and slowly I started loving it. I started being passionate to my profession. Now I love to create a lot of dental awareness. So my from right from the day I entered my internship. So whenever there is an opportunity to attend a dental camp, I used to volunteer. I have been to Gudalur. It's a small town in Nilgiris district, and there's one hospital called Gudalur Adivasi Hospital, where they had started this hospital only for the Adivasis who were living in and around the forest area around Gudalur. So they were all have never visited a hospital. They don't even know what is it. So there, it was a wonderful experience. That was my first experience in such a kind of a place, treating tribal people. So thereafter, it just started off, and after I took up dentistry, I mean, I started off my practice. I'm collaborate with a lot of NGOs, a lot of social organizations like Rotary, Lions, Vasavi. So wherever, whenever possible, I conduct camps, and I believe in creating awareness. I don't believe in giving treatment. I believe in creating awareness, because prevention is more than the cure. So,
Absolutely, sir. Because I think dentistry is one very important, healthcare that most of us, very unfortunately, kind of give it a backseat. We don't think it's very important, but I think we don't give that much of importance as much it is there in the West. So that's what I wanted to quickly ask you a few questions.
yes.
So how important is oral hygiene for overall well-being, doctor? Why is oral hygiene very important?
Yeah. So oral hygiene, the mouth is the mirror of the body. So when a patient walks into our clinic, so he complains of any kind of a problem. So we thoroughly check his entire mouth, and there are so many factors which are related to the general health also. So it is very important to keep your oral hygiene neat and clean. So, for example, now three most important functions of your teeth. One is to eat, chew, grind. So you lose one tooth, one molar, you will not be able to eat effectively. So next is for your speech, for your pronunciation. So you don't have teeth in the upper front teeth, you will not be able to pronounce. Third is for your smile. Everybody wants to look good. So you want to have a beautiful smile. Everybody is so wants come to a dentist asking for a smile enhancement. So it's very important to maintain a good oral hygiene to keep your overall general health in a good way.
And one big question, which I think it's there for ages, doctor, how long to brush? I'm like, and what is the paste that we should use? And what kind of brush should we use? Strong, medium, soft? And for how long should you brush? In fact, I'm still struggling to tell my kids, like, for how long should they brush? Though I tell them, like, do happy birthday twice. That's what I've learned lastly. Make your child sing happy birthday 2 times, and then, that's important. That's efficient enough for a child's dental care. But please tell us, how long should we brush our teeth for?
Yeah. So what you asked is a very, very commonly asked question, how long to brush, but there is a wrong notion among the general public. They think that the longer you brush, the more it is going to help you. It is absolutely wrong. The normal brushing duration is only 2 to 3 minutes. You can actually put an thing alarm in your mobile and then start brushing. The normal brushing time is only 2 to 3 minutes. Within that 2 to 3 minutes, you have to cover all the teeth and all the surfaces of your teeth. So you have the front surface, you have the back surface, you have the grinding surface. So you have to cover all the surfaces within that 2 to 3 minutes. So what we try to say is it is not the quantity which matters. It is the quality of brushing, the frequency of brushing, the technique of brushing, and the duration. As I told you, duration is about 2 to 3 minutes, not beyond that. There are people who brush for 5 to 10 minutes. No, they keep hold a newspaper and they keep brushing as long as they complete the newspaper. That is a disaster. You're going to take out all the enamel from your teeth. So the normal brushing time is just 2 to 3 minutes, and within that 2 to 3 minutes, do an effective brushing. That's more than enough.
And you told the technique of brushing. So what do you mean? How do you? I was told that even holding a brush is important. Where, how do you hold a
You
brush?
should have
Because
a proper palm grip, and you start with the upper teeth. You have a junction between the teeth and the gums. So you start with hold your brush at a 45-degree angulation at the junction of the tooth and gum, and you start giving a no stroke from above downwards. The upper teeth from above downwards, and the lower teeth from below upwards. So you start brushing from the last tooth on one side to the last tooth on the opposite side, and you finish all the outer surfaces. Then you go to the inner surface, same way from the upper teeth from above downwards and lower teeth from below upwards, and finally the grinding surfaces. So with that, cover all the teeth. And as you commonly asked question is, what kind of brush is being has to be used. So the markets have you have this soft, medium, and hard, but what we recommend is only soft bristle brush. So anybody and everybody universally recommended toothbrush is the soft bristle brush. Never use a medium or hard, because they are going to harm your teeth in a big way. They're going
And how about flossing, doctor? Because there is always few dentists say flossing is good, few say it actually create gaps between your teeth. So what do you suggest for
No,
flossing?
flossing will never cause gaps between your teeth. It is a very good oral hygiene habit. It's like floss is nothing like a thread. You take about 10 centimeters of the floss, twist it around both your index fingers and pass it in and out from between two teeth. So it's a very common practice in the West. All the patients there keep doing this floss. Basically, it is a time-consuming, habit, but you do that. It will take you to a very great way, because it is going to help you to prevent cavities, in a big way. Because when you brush, only the outer surface are being brushed. Now, the interdental spaces, that the space between two teeth, is the place where a normal brush cannot reach. So those places, if you want to clean it, the best way is to have a floss. Now, if the gap is too big, we have something called interdental brushes. Interdental brushes which can go through and through between two teeth. So that also will help you to remove, because usually people tend to put a toothpick or a pin, you're actually widening the gap. So the best way is to floss. Maybe not every day, once every 2 days or once every 3 days is also, it will also be very helpful to you.
And what's your call on these electronic brushes, doctor?
Electric brushes are also very
Electric.
good, ma'am. The motorized brush, the battery brushes.
Yes.
Now the trend is the electric brushes, especially the younger generation. They have a lot of fancy ones available. Basically, it also does the same. You just don't have to do the rotation. The brush does the rotation for you. And nowadays you have, it gives you a beep sound when you go beyond that duration, or if you're applying too much of pressure than what is recommended. So battery brushes are also great. You have few of the companies which offer very good ones, and right
But
from
it is
various
also,
sizes.
yeah, it is also told that it hurts your enamel, doctor, these battery brushes. Is that true?
Not really. If you are, again, the pressure, so it should not, no, you should not be applying too much of pressure. So you should have a control over that brush. And if you're going to be gentle on your enamel, it is not going to harm you. And that is usually, recommended for this special children. So where they have this problem to move their hand, they are not, mentally, normally for them, you can use it. If somebody else is doing it for them, you can always recommend, motorized brushes.
And how about the diet, doctor? It has been told that you shouldn't eat very corrosive food that's going to hurt your enamel. So all these concepts have actually come up in the last 20 years, which is actually not sunk into the minds of the public right now. So how do we choose which food to eat, which food is good for tooth, which is not, and like how do we take care of diet and our oral hygiene?
Yeah. So diet plays a very, very important role in our oral hygiene. So nowadays, what we give to our children, most of the food is all processed food or refined food, packaged foods. All these are very, very bad for your teeth, because they are very, very sticky in nature. So anything sticky, what happens? It's like, you eat, you have your dinner, and what if you wash the plate immediately in the night, it's, or what, you leave it overnight and wash it in the morning, what happens? That soft debris becomes hardened, so it is difficult. You will have to apply more pressure. So we always ask all our patients, right from of any age, to avoid the sticky food, especially in the nights, at least 1-2 hours before going to bed. See, most of us have the habit of going to parties, or children go to birthday parties, have all this cake and pastries and all that. They come back home and they just go to bed. So our teeth are not like, they don't have a flat surface. They have pits and fissures. So there are cusps. So the sticky food gets stuck to the pits, and that is what. And our saliva, the oral saliva has microorganisms. So when these microorganisms present in the saliva come in contact with the sugar, of the food which is stuck, the remnants, that is when it releases an acid. It's called lactic acid, and that is what starts eating away the enamel, and that's how the cavity forms. So that is why we emphasize on nighttime brushing. At least if you're not able to brush, at least you rinse your mouth with a mouthwash. Yeah, so that will take you to a long way. So sticky food is usually to be avoided. I mean, when you are in the daytime, it's okay. Once in a while, it's okay. So people who have the habit of having chocolates before going to bed, all these are very, very bad. So more of fibrous food. I'll give you a simple example. Nowadays, how many of the children try to bite on a sugar cane? Nobody wants to bite on a sugar. You give them a juice, sugarcane juice, they will happily drink the juice. But if you ask them to, you give the sugarcane and ask them to peel the skin, nobody does. Oh, you peel it and give, or you make it in, give a sugarcane juice. That is easy for them. So those days have gone. When our fathers, forefathers, ancestors, they used to bite the sugarcane. So very simply, you have this accrued. So nowadays nobody even tries to bite an accrued. You open the shell, give the fruit, and then they eat. But to bite it, it's like a big task. Like everybody is scared to bite on accrued. So that is the kind of attitude you have, because that is the kind of food. Everything what we eat has to be soft. We just want to swallow. Nobody wants to bite. Nobody wants to use their teeth. That is, I will come to that when we talk about wisdom teeth.
Right. And so technically, you suggest that every time we have a meal, we rinse our mouth and then probably brush twice a day. So that's good for a good oral hygiene.
Absolutely, absolutely.
Right. And doctor, like, what will be your because of late when I get to see kids per se, because you rightly said because they're having a lot of sugary food and stuff like that, and there's no much of fiber that they are eating. So, what would be the suggestion you give for kids in particular? Because they have so much of a sweet tooth coming over, and they have cavities. Root canals are becoming so common these days, and like, so what would you suggest? And are there any exercises for the teeth as well to keep them very strong?
Yeah. Now, see, I would like to emphasize on the importance of the milk teeth. So most of them, there's a wrong notion that the milk teeth don't have to be maintained. Milk teeth need not be, maintained well. So that is a wrong notion. So what we keep telling parents is milk teeth are as important as permanent teeth. So the first milk tooth comes into the mouth at the age of 6 months when the child is born, 6 to 8 months, and completes eruption by the age of 3 years. So, and after 7, 8 years, the milk teeth start shedding. One after the other, they start falling off, and one after the other, the permanent teeth start coming into the mouth. So most of the parents, they neglect, they take it for granted. So they go to any normal pediatrician. They show that there are a lot of cavities, and there is no awareness that the milk teeth have to be safe, because milk teeth lay the foundation for proper foundation for the jaw growth. They lay the proper foundation for the proper growth of the permanent teeth. Now, let's say a milk tooth, a milk molar, which is supposed to fall at the age of 11 or 12 years, because of the decay, because of the ignorance of the parents, they get it removed at the age of 5. What happens? That space, the tooth which had to fall off at the age of 12 is being removed at the age of 6. So what happened? That space, that 6 years, that space is not no remaining the same. So the adjacent teeth slowly start encroaching into that space. And what happens? The permanent tooth, which is supposed to come into that space at the age of 13, will not have space. So that will come out in a crooked way. So there is no malalignment causing, and the jaw size also starts shrinking at that place. So there is jaw growth affected, and the permanent teeth growth also is getting affected. And let's say they don't attend to the cavity. Now what happens? The cavity starts progressing. It goes so deep that it will affect the permanent tooth bud which is inside the jaw. Okay, so the permanent tooth which is about to erupt, it will come out with the decay. So it gets infected. So imagine that a tooth is coming out into the mouth at the age of 13. It's already decayed. So see, it is supposed to last till the end of that person. So it's already decayed. So there is a compromise then. So it has to be attended to. So we keep emphasizing that milk teeth also have to be attended. So another major mistake what parents do is this nursing bottle caries. We have something called nursing bottle caries. So where the children are fed milk with the nursing the bottle fed. So what happens? The mother puts them to sleep along with the bottle. So what happens? The child goes off to sleep with the bottle, and the last sip of the milk is no. The child forgets to swallow the last sip of the milk, and there is sugar in that milk. So what happens? That milk remains in the mouth. There are remnants of the milk all throughout the night, and which causes decay. So if you see, we get a lot of patients at the age of 3 to 4 or around 5. The parents bring the child saying that there are cavities in all the upper and lower front teeth. That when we actually asked them the history, they said, yeah, I used to bottle feed, or even that is also happens when the mother breastfeeds them. So usually you have to stop breastfeeding by 1 or 1.5 years. So, but some parents, some mothers breastfeed till 2, 2.5, 3 years also. So what happens? That again, the child goes off to sleep, and that's they feed the child to put the child to sleep. So that the child forgets to swallow, and that is called nursing bottle caries. So that is also very, very important issue we would like to address. So that we keep giving that awareness to the parents.
Oh, this is actually very important for me, doctor. I wish I had known it a bit earlier. Oh God! Oh, that's actually that's very insightful. In fact, we've never thought of that in that fact in that aspect. In fact, there are friends of mine where the child will be sleeping, wake up the child in middle by 3 a.m.,
Yeah,
feed the child.
yeah. What we tell them is never feed the child in the middle of the sleep. No, the child gets up in the middle of the night, they cry. They immediately they bring milk in the the bottle, and put the bottle into the mouth. And they're happy the child goes to sleep. But the after effects are so bad. So what we say, in case if you're very particular that you want to feed the child in the middle of the night, you wake up the child, you give it in a glass, or you try to avoid sugar in mixing sugar in that milk. So because sugar is the culprit. So then they say, no, you don't add sugar, my child doesn't drink. Then what we say, you don't cut the sugar at once. You gradually reduce the quantity and finally start giving plain, milk in the night. Or actually, it is better to avoid. Better to avoid giving any milk in the middle of the night. You feed the child before going to bed, and you feed the child after the child gets up in the morning.
And now coming to another point to get clarification, doctor, I'm like tooth biting. Like I've seen this is across age. When people sleep, they keep biting their teeth with so much of pressure. Why does this happen? Why do people bite their teeth when they are sleeping, and what's the impact of it on the teeth?
Yeah. So this is called night grinding, or it's otherwise called as bruxism. So it's a very commonly seen in children, when few children, especially who are they have a lot of fear. Psychology also plays. So even if sometimes if the child has worms in the stomach, also can even those children tend to grind their teeth in the nights. So that is, they grind so much, not only children, even adults. We have a lot of
Adults,
adults who keep
exactly.
grinding their teeth. So when they have a lot of stress and they go to bed with the stress, there is a tendency of biting their teeth. So this is actually has to be, addressed at the early stages. So if it is left unattended, what happens? It will, erode the enamel. There is a lot of attrition of the enamel. The enamel, it wears off so much that it becomes like a table. That the molar becomes like a table. It will also have an impact on the joint. We have something called a temporomandibular joint. This is where the lower jaw meets the upper jaw. The mandible meets the maxilla. It's like a ball and socket joint. So what happens there? Because of excessive pressure, it's like, I'll give you a simple example. You are about 60 kilos, and you can carry a suitcase which weighs about 80 to 90 kilos maximum. Now, what if I ask you to carry a bag which is 100 kilos? You have to apply a lot of pressure, and it will have an impact on all your joints. So same way, if you're applying so much pressure that it will wear off the joint also. Over a period of time, they start having joint pain also. So it is we'll have to thoroughly take the history and find out why they are grinding. So for such patients, we have something called as splint, a soft splint. It is made of it's like a rubber. It's a 2 mm thickness of rubber, and we take an impression. It is customized. It is tailor made, and put the patient on those splints, soft splints. The patient wears it only during the night before going to bed, so that even if they're chewing or grinding their teeth, it is like it's a shock absorber. Whatever grinding happens, the impact is on the splint and not on the teeth. So what will happen? After 3 months or 4 months, you call the patient for a review. You will see the splint getting worn out. So that much of pressure is being put on the splint, so that you can actually know what is the intensity of severity of the grinding the person is doing. So
And
it has
doctor,
to be addressed.
yeah, and doctor, usually it is presumed that only smoking is bad for your oral hygiene, but technically even drinking is bad for oral hygiene. Even that hurts the your enamel, your the health of your teeth. So can you just give us some insights? Because it's always believed it's only the smokers who have to take care of their oral hygiene and just be a bit watchful.
Yeah, yeah.
So how is it on alcohol?
See, smoking is actually, it contains tobacco, and tobacco has this addictive material called nicotine, which acts on the brain and it causes the addiction. And the patient has this craving, and that is why they keep on smoking. Once that craving reduces, they go back. They take another puff. So same way, this alcohol also will cause a lot of issues, because when they try to have alcohol, they mix the alcohol with soda or any kind of carbonated drink. So what happens? This carbonated, drinks will eat away the enamel. It causes erosion of the teeth. So over a period of time, there is the wear and tear of the teeth and causing sensitivity and other tooth loss. And it also causes bad breath. So not only smoking tobacco, I mean, usually people have a wrong notion that only smoking can cause cancer. It is not only smoking, it is even chewing tobacco. So they only smokers are affected. They think it is not that way. Whether you smoke or you chew tobacco or smoke tobacco, inhale, that is hookah, whatever, everything is can cause cancer. Everything, all these tobacco products have carcinogens, products, chemicals which can cause cancer. And if you actually conduct a survey, if there are 100 people getting affected because of cancer, now almost 40 to 50% of the cancer patients would have had a history of consuming tobacco or alcohol. So it is a big non-communicable disease, which is very, very prevalent in our country. NCD we call it. So
And
it has to be addressed too.
how about coffee tea to the teeth, doctor?
Coffee, tea, see, anything which is consumed within limits is very, very safe. So you can have a cup of tea or a coffee, but there are some people who have a tendency of getting stains after having coffee or tea. So that is why we say, to rinse their mouth after having a cup of tea. Actually, it is very difficult to, you want to have the taste for some time. You ask the coffee lover or who is a teapot. So you ask them to go rinse. They say no point having a cup of tea or a coffee there. So, but if they have a tendency of getting their teeth stained, then they have no other option but rinsing their mouth. So having a cup of coffee or tea is not bad. I mean, as long as you are within limits.
And coming to the wisdom tooth, which is always a trouble for everybody, 20 plus it starts. And why should we trouble the wisdom tooth, and why is the wisdom tooth troubling us? Should we let it go the way it is, or should we pull it out? Because when we extract it, the alignment changes. I know a lot of my friends who started having jaw issues. So how do we handle this wisdom tooth problems?
Yeah. Now, see, when you go through our science textbooks, what does our science book say? We have a normal human being has 32 teeth.
32.
Now, I'm going to give you a shocking news. Now, the concept of 32 teeth is gone. It is no more 32 teeth. It is going to be 28 teeth from now onwards. Because, see, if you actually see, if your parents or your grandparents, the jaw size used to be so big that it would easily comfortably accommodate all the 32 teeth. Now, their diet was totally different. Their lifestyle was totally different. As I already told you, nowadays, our generation, our next generation, they're all, they keep taking in all this processed and, fast food, and nobody wants to chew anything. There is no fiber. Anything hard is not good for health for them. It is not tasty. So we have stopped giving work to our teeth. So because of that, the jaw size is shrinking. Now, that is why the present generation, now usually the wisdom teeth is supposed to come out into the jaw at the age of 18. 18 to 25 is the age when the wisdom tooth usually comes out. Nowadays, if you find 100 people of this age, 99 of them have this wisdom tooth problem. That is because of the jaw size and tooth size discrepancy. Jaw size and tooth size discrepancy. Because the number of teeth are the same. The number of teeth are the same, but the jaw size is becoming smaller. It is no more big enough to accommodate all your 32 teeth. So invariably, the wisdom teeth are getting impacted. They're getting buried inside your jaw. So they either come out in a wrong direction, or they partially come out, or they're completely buried inside the bone. And once the person crosses 25, 30 years, that is when they start giving pain, because where partially erupted wisdom tooth is covered with the gum. So what happens? There is a pocket between the tooth and the gum, and food gets stuck. Food gets lodged there. It goes in, it doesn't come out. So unless you do a rigorous rinsing. So over a period of time, the wisdom tooth gets infected, and it starts giving you pain, and you will have to take a full mouth X-ray and check the position of the tooth. And what happens? So when a tooth is in a wrong direction, the front tooth, there is a junction between the second molar and the third molar. Third molar are all usually called the wisdom teeth, and the second molar also gets infected. So you have to get the wisdom teeth removal. This usually, what happens? What we advise is the girls who are getting married. So what happens? The girls usually get married in between 23 to 27, whatever. So that is when, and they immediately they get pregnant. So what happens after they get pregnant? They come back to us with a wisdom tooth pain, and we are totally helpless. So once you get pregnant, we are not supposed to prescribe medicines, not supposed to prescribe antibiotics. We cannot take radiographs, because the radiographs are not allowed for a pregnant woman. So that is why we tell dental makeup, like how a girl goes for a bridal makeup, we also tell go for a dental makeup. Make sure you have no cavities, because once they get married, nobody can guess when they get pregnant. So it's not in our hands. So usually we tell them to go for a thorough checkup. So you have an infected tooth, if you have a cavity, because they can't go for a root canal treatment also. So especially the wisdom teeth, props up, gives problem only when they get pregnant somehow. So a thorough dental checkup is very important.
Yeah, Doctor, but how did this sudden, less space has started in our, the buccal cavity or whatever? Because how is it suddenly
I told you, because of the lifestyle changes. The jaw size is shrinking because of our diet. Our diet has completely changed. So they used to eat raw rice. They used to bite on vegetables, fruits, raw food. Now we are eating. Now we don't eat anything raw. So we are giving very less. Now you keep watching. After 20 years, 28 will become 24. I've already seen children with the second molar being impacted. They have no space for the second. Forget third molar. The second molar also is getting impacted. So that means
something like we have to do some jaw exercise to get it a little more spacious, or what?
Diet from the early childhood, we should make sure the child eats a lot of fruits, vegetables, fiber food, bite on all dry fruits, nuts. So the chewing is very, very important. Chewing is very important, so that you give work to, you give job, you give exercise to your jaws. It's not like you don't have any
exercise actually.
There is no exercise.
No, but doctor, you're very right, because most of them, even in fact, this fast food world, people don't have time to chew. So I saw most of them just swallowing food.
Yeah,
be
exactly.
it roti, be it rice, they have to just rush. Yeah, in fact, probably chewing is one thing that most of us actually are
forgetting.
We've stopped it. And doctor, now coming to, we spoke about wisdom tooth. So I also want to know about this teeth whitening, which is actually becoming very predominant these days. Yes. So should we do it? Should we not do it? How different is it from just scaling, just normal scaling of your teeth? How is this whitening? Does it really help? Should we do it or not? And if you can, what is the age that a person can experiment on?
Yeah. See, scaling and whitening are two different entities. Scaling is removal of the external dirt and deposits from your tooth surface. So if a person who has a lot of calculus or deposits, a lot of stains, tobacco stains or tea coffee stains or stains because of something else. So any external stains can be removed by a normal routine cleaning. But whereas the whitening is, you want to change the internal color of the tooth. Now, for example, there are various shades of teeth. Some people have white, then you have they grayish, they have you yellowish, dark yellowish. So people who are very, conscious about their smile, they come to us asking for whitening. There are a lot of whitening procedures available. You have in office, you have at home. In office is like, we do it in the dental office on the dental chair, and it takes about half an hour to 45 minutes or 1 hour, depending upon the severity. And people who don't have, enough time, they want to carry it home. We have home bleaching kits available. So we have to make this, customized trays, and we give them the bleaching agent, and they use for about half an hour every day for about 15 to 20 days. So there are a lot of nowadays you have these pen type bleaching agents. You are in the West, they're very common. You're going for a wedding, going for a party or a celebrity, you want to have a bright smile, you just buy that pen, apply it. But over a period of time, I would say be happy with your natural color of the teeth.
But
See,
what will be the side effects for this bleaching?
side effects, yes, there is no major side effects if you're doing it once in a while. People who are doing it on a regular basis, because they use an acid. Basically, they use an acid, to bleach. So if you're using it on a regular basis, it is going to have an impact on the teeth. It might erode the enamel. So once in a while is okay, no, not at all an issue. And usually, what happens immediately after bleaching, the patient will have mild sensitivity to hot and cold food. So they are put on desensitizing toothpaste, to control the sensitivity. So once in a while is okay, but on a regular basis, I don't suggest. But see, you are going for you're the groom or the bride. You want to look the best on the big day. So it can always be done. Nothing wrong.
And there's also like a lot of cosmetic the trends running on your teeth, and like there is a stone which is being pierced. There are a few crazy things which are happening. So what is your call on that, doctor?
Yeah, that is called a tooth jewel or a dental jewel. We have
Right.
these skies. It's like a small stone. No, we have various sizes and shapes and colors available, and we show them, and they want to. It's like it'll just give a sparkle when you smile. When there's a light falling on your, it's just to make heads turn. So nothing wrong. We do that. There are people who walk into our clinic asking for a dental jewel, and some people want it on the canine, some people want it on the central incisor. Some people want small ones, some people want white color, some people
And
want.
will this all create sensitivity in the
No,
future?
no, no. It is like, you fix it with a gum. That dental jewel doesn't cause any harm. And
Okay.
only thing is, over a period, you keep brushing, it might just come off, and that's it.
Yeah,
So that
so it
is not
doesn't
going to
have
cause
any.
any harm.
Okay, okay. It doesn't have any scary side effects.
Yes.
And so, doctor, I think we've asked you all basic questions, because most of us, what we do is we get into the Google, we do a lot of research, we get into understanding of the most of the advanced, issues of dental hygiene and stuff. But the point is, we don't even understand the basics of dental hygiene. And you've been really kind enough to give your
Thank
time
you.
and answer the smallest of our queries which we have raised in this day. And I also want you to give us a closing advice to all our viewers who've been watching this. Like, what would you tell them, and what is the suggestion you give them for keeping their dental health good?
Yeah. So to wind up, see, basically what I would suggest, brushing twice a day is most advisable. As I already told you, you always use a soft bristle brush. Next question is how long to use a toothbrush? As long as it doesn't fan out. So the moment it fans out, it's time to replace your toothbrush. So that is one aspect. Second is I strongly suggest that you do a thorough gum massaging. So if you're spending about 2 to 3 minutes of in your brushing, you use 1 or 2 minutes on your to massage your gums. So if there is a lot of blood circulation in your gums. So when you massage your gums, there is a lot of blood circulation. When there is a lot of blood circulation, there's a lot of oxygen. So it's like you go for a massage. So what happens? There's a lot of blood, you're pumping in a lot of oxygen to the tissues. So you feel fresh. Same way, same principle to your gums also. Next is to clean your tongue on a regular basis. So you have to use plastic tongue cleaner. Never use a metal tongue cleaner, and remove that soft debris which is formed over a period of time. And next is you can use a good mouthwash, or just with plain water, salt water also will do good. And you, as I already told, you can use a floss. There are a lot of companies available in the market. You can use a floss maybe twice or thrice a week. You can also use oil pulling. Oil pulling also is very good. You have this sesame oil. We call it nallanai. So that is very, very good. It removes all the toxins from your mouth. It gives you fresh breath. Even prevents decay, and it is also good for overall health. Oil pulling is very good when you do it even before you brush. So
can we do oil pulling on a daily basis, or how many?
Yes, daily basis is very good. It is very good. It will be very helpful to maintain a good oral hygiene. And last but not the least, before I went, any paste is okay. If you ask me which paste, see, I don't promote any company. It's like, you use any medium. Just paste is just a medium to clean. It's like, you put, whether you use Hammam or Lux or Synthol, you just basically removing all the dirt from your skin. So same way, you can use any paste. Paste is just a medium. And, finally, you have to visit a dentist once every 6 months. That is very, very important.
Wonderful. Thank you so much for your time, doctor. It has been really overwhelming for us to know certain facts that you have told, that from 33 we've come to 28 teeth, and now we really have to take care of ourselves and probably the generation coming next. And it was a wonderful conversation, doctor. Thank you so much, and I hope you had a good time.
Thank you so much for this wonderful opportunity. I had a lovely time meeting you. Nice meeting you. And sir has been so kind enough to give me this opportunity, to share my views about oral hygiene and its importance.
Thank you. Thank you. Thank you, doctor. Thank you so much.
Thank you, ma'am. Thank you so much.